on the surface of the right temporal horn lateral ventricle to the parietal lobe of cortex. Gray matter cleft is extended from the surface of the right temporal horn of lateral ventricle to the parietal lobe cortex. CSF signal is seen within this cleft. The cortical callosum is present, but the septum processus is absent. Diagnosis: open ribs, encephaly. Before this, in the MCQ, they are saying that there's a CF communication, uh, CSF spaces which is communicating with the CSF space of the lateral ventricle. What is diagnosed? Encephaly. Here, the thing, the gray matter cleft extends from the um, parietal lobe cortex to the lateral ventricle. So anyway you describe the finding, it is uh, good, it is accurate in talks. Question number 28. In this porencephaly, schizencephaly, lissencephaly, and pachycardia. Question number 28. A 26-year-old child skull X-ray with multiple intracranial ossicles were seen. The point should be considered Down syndrome. Multiple intracranial ossicles means Gorman bones seen in Down syndrome. 26-month-old child skull X-ray with multiple intracranial ossicles. What is following should be considered Down syndrome. It is due to Gorman bones. Question 29. Premature baby girl cranial ultrasound right periventricular flare and hydrocephalus. Repeated cranial ultrasound with diffuse cystic changes. The premature baby cranial ultrasound shows right periventricular flare and mild hydrocephalus, and repeated ultrasound shows cystic spaces, cystic change in the right periventricular region, and dilatation of the right lateral horn. Diagnosis: periventricular leukomalacia. What is periventricular leukomalacia? It is white matter injury of prematurity. It is also called white matter injury of prematurity. It's seen in premature baby, and it appears as an intracranial hemorrhage, and then afterwards it develops into cystic spaces. So what is it called? It is also called white matter injury of prematurity or periventricular leukomalacia. Question number 30. Maternal alpha-fetoprotein level was very high, and obstetric ultrasound with banana sign and the Lemel sign was most likely cause neural tube defect. Banana sign, Lemel sign, and banana sign diagnosis neural tube defect. Lemel sign and banana sign diagnosis neural tube defect. Question number 31. MRI T1 and T2 where images showed cerebellar atrophy and flare sequences revealed hyperintense rim along the cerebellar margin and the brainstem, were most likely diagnosed chronic subarachnoid hemorrhage. Okay, MRI T1 T2 where it shows cerebellar atrophy and flare sequences revealed hyperintense rim along the cerebellar margins and the brainstem, hyperintense rim along the cerebellar margins and brainstem diagnosis chronic subarachnoid hemorrhage. Hyperintense rim along the cerebellar margins and brainstem diagnosis chronic subarachnoid hemorrhage. Question 32. Unconscious following a house fire. MRI head show low signal intensity on T1 where images and high signal on T2 where images and flare images. When the medial portion of global spirals, bilaterally monocyte diagnosis carbon monoxide poisoning. aka carbon monoxide poisoning. Both global pyridine involved. MRI head shows low signal on T1 and high signal on T2 where images within the medial portion of the global pyridine. In the middle or portion of the global pyridine diagnosis carbon monoxide poisoning. Low signal on T1 and high signal on T2 where flare images within the middle portion of the global pyridine diagnosis carbon monoxide poisoning. The Far's disease is cytomegalovirus CMV infection, and they talk about osmosis, diffuse hyperdensities, periventricular hyperdensities, or calcification seen in CMV cytomegalovirus infection, and this is Far's disease, FAHR disease, Far's disease. Question number 33. PRES, posterior reversible encephalopathy syndrome was suspected. What features would be expected on CT? Low density white matter changes within the occipital lobes. Low density white matter changes within the occipital lobes is seen in posterior reversible encephalopathy syndrome. Low density white matter changes within the occipital lobe is seen in posterior reversible encephalopathy syndrome. It's just to remember that the patient in the clinical period he has papillary edema, so it may be dysfunction in occipital lobe posterior. But normally Though density white matter change is seen as posterior reversible in Bathy syndrome. Next, CT scan of 1 cm lesion of the carotid bifurcation. CT scan of 1 cm lesion of the carotid bifurcation. Is it carotid body tumor? Carotid body tumor. Paraganglioma. Important is carotid body tumor. Okay. A 1 cm lesion of the carotid bifurcation with homogeneous lesion with an elevated post-contrast enhancement. A typical salt and pepper appearance was seen on MRI, most likely diagnosis, carotid body tumor. The homogeneous lesion with elevated post-contrast enhancement. A typical salt and pepper appearance was seen on MRI, most likely diagnosis, carotid body tumor. Salt and pepper appearance on MRI and lesion into the carotid bifurcation, carotid body tumor. Next, question number 35. MRI shows high signal within superior sagittal traits and starval sinuses and right transverse sinuses. What were complicated cerebral motor risk, bilateral dynamic infarcts? Now, high signal within superior sagittal and right transverse sinuses when there is truer violent sinus thrombosis, then a further complication is bilateral dynamic infarct. When there is high signal within superior sagittal sinus, straight sinus, and right transverse venous sinuses, further complication is bilateral thalamic infarct because vein thrombus, not artery. Because thrombus is in the vein, not in the artery. If there is thrombus in the artery, then there will be focal loss of gray-white matter differentiation in the part of the vein which is supplied by the artery. But this is both the venous sinuses have thrombus, so there will be bilateral thalamic infarct. Question number 36. MRI shows inferior displacement of the midbrain and clouding of the supracellular cistern. Following contrast, there was strong enhancement of dura, most likely diagnosed cerebral or hypertension. Now this is inferior displacement of the midbrain and clouding of the supracellular cistern, and there is strong enhancement of the dura, most likely diagnosed cerebral hypertension. In the scenario, the patient would have been, in some case, question 36. A 40-year-old man was making a good recovery following drainage of post-traumatic large volume extracorporeal bleed. He suddenly deteriorated 24 hours following surgery, and repeated CT does not demonstrate reaccumulation of the bleeds. So, these all signs and symptoms. MRI shows inferior displacement of the midbrain and clouding of the supracellular cistern. There is strong enhancement of dura, diagnosis cerebral hypertension following the drainage of the bleed. Question number 37. Diagnosis of trigeminal neuralgia. MRI which vessel is most likely involved? Superior cerebellar artery. Okay, diagnosis of trigeminal neuralgia. Trigeminal neuralgia involves cranial nerve number 5, trigeminal, which goes in foramen rotundum. 5. Foramen rostrum. In foramen rotundum. It goes cranial nerve